Om Dham Dhanvantare Namah. Cerebrospinal fluid analysis. A cerebrospinal fluid analysis evaluates the fluid surrounding the brain and spinal cord to diagnose central nervous system infections, for example, meningitis, bleeding, cancers, or autoimmune disorders. The fluid is typically collected via a lumbar puncture, spinal tap, and sent for testing. Normal reference ranges. Test results are evaluated by looking at physical, chemical, and cellular properties. Opening pressure 90 to 180 millimeter of water. Appearance clear and colorless. Protein 15 to 60 mg per dl. Glucose 50 to 80 mg per dl. White blood cells 0 to 5 cells per milliliter, all mononuclear, and red blood cells 0 cells. How results indicate disease? Infections. Bacterial meningitis typically shows a drop in CSF glucose, often ratio less than 0.5 compared to blood, extremely high protein, and a surge in WBCs. Bleeding, subarachnoid hemorrhage, presence of RBCs and xanthochromia, yellow discoloration of the CSF from degraded red blood cells. Autoimmune disorders, for example, multiple sclerosis, presence of oligoclonal bands, specific proteins that do not appear in matched blood samples. The meningitis differential diagnosis encompasses a broad spectrum of infectious and non-infectious causes. Clinicians must rule out life-threatening conditions like encephalitis, brain abscess, and subarachnoid hemorrhage, as well as consider specific bacterial, viral, fungal, and autoimmune etiologies. A definitive diagnosis requires a lumbar puncture to analyze cerebrospinal fluid. The differential includes infectious meningitis, bacterial, Streptococcus, pneumoniae, Neisseria, meningitis, Haemophilus influenzae. CSF findings typically show elevated opening pressure, high polymorphonuclear or neutrophil count, low glucose, and high protein. Viral. Enteroviruses, HSV, VZV, West Nile. CSF findings normal or elevated pressure, lymphocytic pleocytosis, normal glucose, and normal or mildly elevated protein. Fungal Cryptococcus neoformans, often in immunocompromised patients, and tuberculosis and spirochetal, Mycobacterium tuberculosis, Treponema pallidum, syphilis, Borrelia burgdorferi. Non-infectious meningitis, that is aseptic. Medication induced. There is NSA IDS, trimethoprim sulfamethoxazole, IEVIG. Autoimmune and inflammatory. Systemic lupus erythematosus, Behçet's disease, sarcoidosis. Malignant neoplastic, example meningeal carcinomatosis, CNS leukemia, and lymphoma. Meningism mimics. Examples subarachnoid hemorrhage, brain abscess, subdural emphysema or intracranial tumors, central system vasculitis or stroke, severe migraine or delirium tremens. So this is the cytology of cerebrospinal fluid under microscope. Depending upon the different pathologies, the cell or cells types differ. another slide of cerebrospinal setup. So today we have discussed cerebrospinal fluid analysis. It is done after lumbar puncture, planned lumbar puncture. The fluid is collected and is sent to the laboratory for analysis. It is helpful for differential diagnosis of subconditions of brain and spinal cord. Example, meningitis, tumors, hemorrhage, cerebral hemorrhage, etc. Thank you.